Prime Minister Mia Amor Mottley says there are 4 proposals that relate to the expansion of medical and dental services across the island.
Before the government, therefore, lies one clear provision for the establishment of a dental school, which is now advancing at a far quicker rate than it had been during the pandemic, obviously, and 3 proposals for hospitals not only focused on domestic care, but a combination of domestic care and medical tourism. We have the talent and the capacity. We need simply now to set the vision and the standards and to ensure that we do not fall from them.
The Prime Minister was speaking as the Glebe Polyclinic was renamed the Frederick Freddie Miller Polyclinic. During the proceedings, a list of Miller's various contributions during his career in public life were highlighted. Speakers included St. George North MP Tony Moore and Acting Health Minister Dr. Sonia Brown.
And for me, why I say it is an honor not only as the MP for the area, but his journey even before the Ministry of Health and even before becoming parliamentary representative. His journey would have involved another one of my passions and something that's very dear to me, service in the movement of labor.
Under his watch, construction commenced with the new General Hospital at Martindale's Road. A new block of 40 beds for tuberculosis cases was erected at the General Hospital, and government provided funds to enable all drugs used in the treatment of TB at the St. Michael Chest Clinic to be supplied free of charge. Their nurseries were recognized as a necessity in Barbados. One such was Brentmore Day Nursery at Ellerton St. George, which was one of the nurseries maintained with the financial support of government. Old age pension was increased. Many communal baths all across Barbados were put in place.
Miller's daughter, former Deputy Prime Minister and Senior Minister Dame Billy Miller, also spoke of the foundations he laid for some of the iconic Barbadian institutions that exist today.
The BLP lost the government in 1961. Freddie Miller was the only minister to retain his seat. When he left the Ministry of Health and Social Services, he left the outline for the National Insurance Scheme on his desk, together with the plans for what was to become the Queen Elizabeth Hospital. I can speak of my own knowledge about the National Insurance Scheme. A man called Humphrey Walcott was his right-hand man when this was being brought to life.
And the Prime Minister thanked his family for sharing him with the country.
Billy, Luther, Cecil, Buddy, you sacrificed much in sharing your father with this nation. It is something we don't talk about, but anyone who comes from a political family knows that there is much damage along the way, and that very often we do not take sufficient time to understand the implications of what service means.
Apart from Miller's name, visitors will also see his portrait, which is mounted inside the facility. Reanne Phillips, CBC News.